Welcome to this video. My name is Abe. I'm one of the managers here at Advanced Medical, and this video is about GAE and how it can help you eliminate pain for good in just 20 minutes. So first, who will benefit from GAE the most? Patients that come to us typically have, here I'll move into this to help you visualize the cursor a little bit, have typically already tried physical therapy, injections, whether it's cortisone injections or gel injections, as well as painkillers. And they've either been recommended a total knee replacement or they might know that they will need a total knee replacement at some point in the future. So what ends up happening is patients will come to us kind of in this gap, in this period where injections are not really working anymore and they don't really want to take painkillers. So they'll live in pain, just trying to figure out how to get through the day with no real solution because, again, they're trying to avoid or delay a total knee replacement. So GAE is the procedure that fits that gap. And that's important for a few things. Number one, it's finally an option that allows you to get the relief you're looking for without surgery. But number two, it's important to recognize that this is a procedure, and we'll talk a little bit more about that in a moment. That being said, if you have not tried injections or painkillers or therapy, basically, if you have not tried any conservative treatment in the past, it may be best if you go to consult a primary care physician or a pain management doctor first. And then you can always revisit this conversation or this video or reach out to us at another point in the future. So again, this is really for people who have already tried and failed conservative treatment and they are trying to avoid or delay doing a total knee replacement. GAE will help provide that option. Now, GAE is a procedure. However, it's important to note that it's a very simple procedure to do. It takes about 20 minutes. We do it right here in one of our offices. Depending on where you're watching this video from, we've got offices across the country with some of the top interventional radiologists who've gone to the most prestigious schools and have the most experience doing GAEs in the country. And finally, almost finally, it's fully covered by most insurance plans, and this includes Medicare and Medicare Advantage. Now, if you want, transparency is important to us, right? So if you want to be very clear on what costs might be associated with this procedure, if any at all, we invite you to give us a call. All the information will be below this video, so you're more than welcome to skip to it and go to it right now. But I would highly recommend that you continue watching the video because one of the last most important parts about this is the success rate, not just by us, but from a lot of medical journals, is 99.7%, which means it's exciting because it's a very safe and high efficacy procedure. We've had hundreds and hundreds of patients come through us and have had phenomenal results doing GAEs. So we would love to have you join and become one of those happy knees as well. To explain the procedure and help you understand why it's going to help make such a big difference, there are two problems in your knee. Number one is the degenerated cartilage, which is unfortunately not something that we can solve, but that's only half of the problem. Inflammation is the other half of the issue. So if you look here, I'll go back over here. If you look at this part of the knee, inflammation ultimately causes irritation in your nerves, and irritation in your nerves is what causes your pain. So unlike injections, whether it's gel or cortisone, we are actually going into the knee, finding these problematic arteries or inflammatory arteries and fixing them. So again, to compare that with injections are typically it's a Band-Aid. It doesn't actually solve the problem. Cortisone will make the pain level go down, but it won't solve the reason why you're having pain. Gel is the same thing. It'll make the symptoms of your pain go down, but it's not actually solving the problem. GAE, because we are going into the knee looking for these arteries that are causing inflammation and doing what's called an embolization, that will ultimately solve the problem at the core that's causing your pain. Now, again, like I mentioned before, the procedure is a very easy procedure to do. It takes about 20 minutes, but the best part about it is how much of a reduction in pain that our patients will experience from it. So on average, our patients will get anywhere between a 60 to 80% reduction in pain, which is we would love to say 100%, but that would be amazing. But hopefully the goal of the procedure is to allow you to avoid or delay doing a total knee replacement. And most of our patients that come in, they'll tell us they have a 6 to 9 out of 10 pain. Sometimes they'll joke and they'll say they have a 13 out of 10 pain, which we totally get. I know it's funny, but not funny at the same time. After doing the procedure, that'll typically bring the pain down to about 2 to 3 out of 10. So again, we know it's not 100%, but the goal is to get you into a state where you can physically go about your day without being burdened with all the pain that you might be experiencing. Whether it's you want to travel more, or you want to just be able to go to work and not have pain, or you want to be able to go around the house, gardening, hiking, whatever activities it might be, playing with your grandkids. We want to be able to help you restore that kind of function and comfort so you can enjoy those activities without the pain. And finally, I think I mentioned this prior, but because we're solving the problem at the core, most patients get 1 to 3 years worth of relief. We like to say 1 year just to be on the conservative side, but we've had many patients that have had 2, 3, even longer relief from doing a GAE. So you can expect very confidently to have no pain for a very long time after doing this procedure. I guess just to quickly summarize and finalize this video, again, it's a 99.7% success rate. The efficacy and the safety of the procedure is very high. The whole point of scheduling a consultation is to go through this information with the doctor as well. So just keep that in mind. We're going to reduce the pain significantly. You're walking home the same day, and it's cost effective. So we will also help check insurance if you need help or want clarity in what costs might be associated with the procedure. Typically, it's just a copay, whatever your typical copay is. But if there's anything else, we would let you know prior to that. So anyway, that is a quick little overview about GAE. Hopefully this video was insightful to you, but I'm sure you may have some questions. So below this video is going to be a phone number, as well as some more information about us. Please take some time to check it out. Give us a call. We look forward to hearing from you. When you give us a call, you can, we're here to help you ultimately. So whether it's more information that you want, if you have other questions that you want to be able to know more about, whether it's checking your insurance benefits, or whether it's finding an office near you, that we're here to help you, like I said before. And that's pretty much the video. So again, thanks for watching the video. We hope to hear from you soon, and we look forward to helping you get rid of your pain. Take care.